Ready?
I got 7 bills, not 8 off.
One, two, three, four, five. I counted them wrong. 1, 2, 3. That's 2, 3.
You need the list to read off when you do it?
No, I'm looking at them now. 7.
mean-
You're right, 7. Thank
Can you
you.
read it easily, or do you want to see this?
Got them right here.
I know you do, but can you just look at it? Do you know where they are?
Up tab 5, 289, 290, 293 by Representative Edwards, and 309 by Representative Earth.
Yep.
And off of tab 8, the Senate wants 291, and
Okay, you got it.
you got Jess and you,
Yep.
294, 295.
Yep. You got it.
All right.
Oh, there's Lou. There.
All right. All right, I'll call the Fiscal Committee meeting to order for October 19th, 2023. And mention that Representative Pearl, will welcome Representative Pearl replacing Senator Pearl replacing Senator Birdsell. And the first item on the agenda is the acceptance of minutes.
So moved.
Motion by Senator Gray, second by Senator Rosenwald to accept the minutes. Is there any further discussion? Seeing none, you ready for the question? All in favor, say aye.
Aye.
Opposed, no. Those are adopted.
I'll abstain, Mr. Chairman. I was not here.
One abstention.
Actually, two
Two
abstain.
abstain.
Two abstentions.
Yes, thank you.
Okay.
Three abstain.
All right, nothing on tab 2. Moving to tab 3.
Mr. Chairman, just about old business.
Okay, old business.
For the last 2 meetings, we have asked for the Attorney General and the administrator of the fund to be here. And they haven't come either time. And they said the first time that they weren't prepared to come, and they would be here this time. I don't see them here this time. We have been waiting for information from them, and we've been waiting for requests from them about changes that legislation could be made to make it more effective in terms of dealing with the problem. That's not happened, and that bothers me. And I'm very concerned about that. I'm very concerned about the settlements. I'm very concerned about the people that are involved. And we've seen a number of stories in the news about that. So I want to voice my real concern about the fact that nobody's coming. Thank you, Mr. Chairman.
And I have the same concerns. I'm told that they have quarterly reporting requirements, and the quarter will be in November. So they will certainly appear then. They will be told that we're waiting for these answers. But it will be a little late for doing any legislative changes. Anything else under old business? Then moving on, the consent calendar goes from tabs 3 through 8. Or through 9. Does it go? No, through tabs 3 through 8. These are the items that will be removed by request. From tab 5, Representative Edwards has requested removing tabs 289, 290, 293. They are all dealing with HHS on a common subject. And Representative Earth has asked to remove item 309. Under tab 8, the Senate has requested removing 291. And Representative Edwards and Representative Earth have requested removing 294 and 295. All of these items are under the purview of the Health and Human Services Department, and they are here, but I wanted to give them warning. But those are the only items removed. The rest of the 26 items, so there's 19 items remaining on the consent calendar.
I move the consent calendar.
Second.
Senator D'Alessandro moves to accept the rest of the items on the consent calendar, seconded by Senator Gray. Further discussion, is there any other items that anyone wishes to remove? Seeing none, All in favor of that motion, say aye.
Aye.
Opposed, no. The rest of the consent calendar is adopted. We're moving now to tab 3 and items. Tab 5. Item 291 is the first one we come to. 289, I'm sorry. Got to read my own notes. 289. And 289, 290, 293, all similar topics. And Representative Edwards is recognized to begin the question.
Thank you, Mr. Chair. These three are bundled together because they're similar in many ways. These are federal funds the state is accepting to assist with a refugee program. My thoughts around this are that in the last couple of years, we've had 7.5 million people come across the southern border. That's 5 times the state of New Hampshire. Many of them have been going to Massachusetts. The governor there has declared that their housing stock is overwhelmed and they may no longer be able to support their law that says that everyone shall be homed. As a result, I think it's just reasonable, given the proximity, for us to begin anticipating what's going to happen if New Hampshire starts to get a significant number of refugees. And so I'm really asking a question of the department about the extent to which we are engaged with. I don't know if it's Homeland Security. I'm not sure which federal agency is managing the inflow of the 7.5 million people. But could you talk to us about what you perceive the risk is? I use risk not as a threatening term, but just as a management term. You know, looking at things that may affect us. Could you tell us what sort of thought process is being put into how many new people may be showing up within the state of New Hampshire in the coming budget cycle till June of 25, and what sort of thought is being put into it now in terms of what sort of demand it'll put on general funds, or given our workforce shortages, what it may mean to our ability to support New Hampshire citizens.
Good morning, Nathan White, Chief Financial Officer. I think to start, I don't know if we came prepared to answer such an expansive question, because that has many assumptions, unknowns, and demographic indicators that I don't necessarily have available with me today. I can hand it over to Ruben Hampton, who is the Office of Health Equity Director, to provide insight into the specifics of these items. But I don't know, Representative Edwards, if I can really give a cogent answer precisely without doing a fair amount of research in response to that question.
So this is similar to the questions I had asked during the budget process, with the standard House budget process, and so I don't think I'm laying a surprise on you that I have a continued interest, given that the issue is just continuing to expand in its potential impact on the state. I just don't want to be standing here in 6 months to 9 months with an enormous bill put on us, and to have an exacerbation of workforce shortages and housing shortages and the like. I'm just not. I just would like us to get ahead and anticipate the chaos that could come from enormous numbers moving into the state. So if there's not an answer today, I will have a continuing interest in this, and let's continue to have the conversation, because no surprise is a good surprise in this case. And I'd love to hear from your last name or first name is Ruben.
Yes, good morning. Ruben Hampton, Director of the Office of Health Equity.
I think I remember meeting you when you were first brand new, right? And it's been almost a year now.
About 9 months, yes, we met at the
All right,
budget hearing.
great. What do you have to share with us?
So, Representative Edwards, the refugee program serves those who have are eligible population. So it would not be any of those folks who would come over. It would be all of those who had been vetted prior to entering the United States. Right? They would have been granted this status prior, and it is only a select few.
So I think I like that answer, but just to really pin it down to make sure I understand it, those people are coming across the border and claiming asylum. Are they categorized also as refugees?
So they are not refugees. Those who have been granted asylum would be asylees and would be considered an OR eligible population, but they would have to have been granted asylum. If they've sought asylum and not been granted it, they are not considered OR eligible and they would not be served by this program.
Okay, so just to nail it, so in these two or these three requests for accepting of federal funds, these programs are not really open to those who have filed an asylum claim but have not yet been adjudicated. They are not eligible for these programs.
They are not eligible, and some of these funds are for specific populations that wouldn't be for those folks anyway. Like some of these funds are for those who are, Ukrainian, right, and other specific populations. But yes, to your point, Representative Edwards, if they have not been approved for asylum, they would not be an OR eligible population. It would not be eligible for the benefits.
That's outstanding situational awareness. That calms my fears about a flood that we can't afford. So thank you.
Move the item.
Second. Do you want to move all three?
Senator Gray.
That's my question. I think that since they were
They're-
on the
they're-
consent, since we've taken them, the testimony individually, if the chair will allow, I will move all three of them, 89, 289, 290, and 293.
Second.
And a second. Motion and a second. Senator Gray and Senator Rosenwald. Further discussion on these? We'll be ready next time with more answers. All in favor, say aye.
Aye.
Opposed, no. The motion is adopted. The next one I have on removal is item 23309. Representative Erf has questions. All right, first we'll recognize Representative Edwards for a question.
All right. Thank you, Mr. Chair. My question about this is that we have a rebalancing demonstration program, and it says very specifically in the final sentence that if federal funds no longer are available, general funds will not be requested. And I always wonder about these. If this is likely to be a successful demo, what would we do? Are we really prepared to wrap it up and shut it down if it's successful, or might it find its way into a future budget? I just want to make sure I'm clear on whether or not we say this out of habit or if we really mean it. Are we really not going to ask for general funds?
Good morning. I'm Melissa Hardy. I'm the Division Director for Long-Term Supports and Services. Thank you, Representative Edwards, for the question. I think I can talk from the programmatic standpoint. We've had a program like this in New Hampshire before, probably 6 or 7 years ago, called Community Passport Program. What we anticipate is that the federal government will continue to fund Money Follows the Person. There hasn't been any indication that this will not be funded through the feds, since it has been an ongoing historic program that they have funded. If it is something that's successful that keeps individuals and into the community rather than in institutional care, I think we would certainly have a conversation about how, if the federal funds stop, how we would have a cost savings in New Hampshire and looking into budgeting that.
But at this point in time, it's our understanding that those federal funds would continue to come, which is why we included that statement. That statement's based on the best possible knowledge that we have available today.
Thank you, Mr. Chair. Just being a purist, it sounds like we're not really saying general funds will not be requested. We're saying that at this time, no general funds are anticipated to be requested. And I don't know if this language is just boilerplate or in law or something, but I just like clarity because these documents speak to the public as well. I just want to make sure the state is saying what it really thinks.
I think for this particular item, we are assured through the feds that we will get this amount. So what we're requesting will be federally funded. Beyond that, I think that would be up to discussion.
Representative Erf for a question.
Thank you, Mr. Chair, and thank you for taking the questions. I actually have two questions, if that's okay. What are the historically underserved communities requiring equitable care?
Thank you. We had to identify that in our application for Money Follows the Person based on some CMS guidelines that we had. So that typically includes individuals in rural communities who have access concerns to services just due to their geographic location. Also, folks that may have some language barriers in accessing or applying for benefits through the Money Follows the Person program. It could be perhaps folks from diverse backgrounds that may not be familiar with what's available out for service delivery, and also folks who struggle maybe just accessing the system itself. So it could be folks who don't have internet access or transportation barriers to actually apply for services.
Thank you. Follow up?
Follow up.
So separate question, not really a follow up. When will the system assessment and gap analysis start becoming available, and where can we find it when it does?
Yeah, so we're currently working with a stakeholder group. We are contracting with a provider to work with that group. The timing of that, I don't know if I have that right in front of me. I will have to get that to you. I don't have that timing in front of me, but I can do that. We're
Thank you.
currently working on that with our stakeholders.
Thank you.
Senator Rosenwald for a question.
Thank you, Mr. Chairman. Good morning. I understand that this is going to be somewhat different from the Community Passport Program, but my question is, how are you going to define success this time?
Sure.
What does it look like? Is it saving money because somebody's not in a nursing home, or is it individual satisfaction or ability to get the services they're approved for, or
Sure.
how?
I think you hit it on the head on a couple of those areas. So part of the MFP program is doing satisfaction surveys, which we historically have not done on the aging side of our business. So that's part of this program. Passport, which is the previous iteration of Money Follows the Person, really focused on transitioning folks out of nursing homes into the community. And for this program, we're really looking at how we're keeping people in the community versus them going into institutional care. So it's kind of a little bit of a swap of thinking and taking from taking people out of the nursing home into the community, but now we're really looking to strengthen the community service to keep people in the community. So I think those are a couple of our measures, as you mentioned.
Further question.
Thank you. So we have an informational item before us today on the Medicaid rate increases. And my understanding is the CFI rates are going to go up about 30%. Won't that by itself go a long way towards guaranteeing that the workforce and therefore the services are available? What else are you looking to do?
Yeah, sure. I think that certainly is a large help on the CFI community, but there's a lot of people living in the community that cannot access CFI, whether that's because they don't meet the medical level of care or they don't meet the Medicaid level of care to get waiver services. So there's a population of folks in the community that receive services such as meals, transportation that is not funded by Medicaid. So they're funded by other grant programs. So we certainly appreciate the historic budget that was passed, and we know our stakeholders are certainly very excited on the CFI rate increases, but there are also folks that can't access CFI just either because of their financial status or their medical status.
Further questions from committee members? Seeing none, I'll entertain a motion. Motion and a second to adopt the item. Any further discussion? Seeing none, all in favor say aye. Aye. Opposed, no. That item is adopted. Okay, moving on to tab 8. I'll recognize somebody from the Senate for item 23-291. Senator Rosenwald.
Thank you, Mr. Chairman. I just, from the narrative, did not understand what this item was doing.
You want to open it? So I'll speak to the financial side of it, and then I will hand it over to Melissa to speak to the programmatic aspect. There's two technical requested actions here. One is transferring funds, and you will see that transfer where we're moving it from the payments to providers to the contract line into 102. And the reason that we're doing that is because there's been changes in the plan, and the other aspect of this is the acceptance of the enhanced dollars into the budget this year. As many of you may recall, we did not include many of the federal pandemic, any of the federal pandemic dollars in the state budget. We've already accepted various ARPA funds earlier. I think it was in June, where the Fiscal Committee accepted those funds, and that's why you're seeing that acceptance being brought here now. And I will hand it over to Melissa to speak to the program.
Yes, so as we do our quarterly reporting to CMS on our spending plan, as Nathan mentioned, we're able to refine some of the financial aspects, so moving those dollars into contracts. So over the past quarter, we've been able to fund some contracts that have been approved through GNC, such as 111 beds for folks with intensive treatment service needs to buy property or refurbish property so they can live into the community. Also, we've been able to award 27 grants as far as workforce retention and recruitment, so about $16.3 million to home and community-based providers for workforce and recruitment strategies. Has not been yet approved by GNC, but we are currently in the final stages of that RGA process. So it's fluid every quarter as we give our update to CMS as far as how we are able to contract out the dollars for our ARPA spending plan.
Further question?
Thank you. Just a quick follow-up. So we've lapsed some of this additional FMOP over the last couple of years. Are we actually going to spend this money? We're not going to lapse it?
I do know that the team is working diligently to move forward. Oftentimes we do have challenges with contracting. Sometimes our contracts don't get through. Sometimes they get tabled and voted down, which just happened yesterday for one of our items. So we work as hard as we can to get these dollars out the door as part of the plan that Melissa's teams work with CMS. We don't intend to have any dollars lapse, but sometimes there are variables that are outside of our control.
Thank you.
Of course.
Senator Pearl for a question?
Thank you. Is any of this money being spent to alleviate the situation that's going on in our hospitals now, where we've got essentially long-term care patients that are stuck there because they can't get placements anywhere else?
I would say that, all of these funds are focused on home and community-based services, and that's certainly a population of folks that we know, whether they could get services through CFI or other home and community-based access services, that would help that flow from the hospital either back into the community. We know that our community-based providers are struggling with staffing, and that sometimes is a reason why we cannot coordinate services from the hospital to the community. So we feel that these dollars, since they are community-based focused, will help some of that boarding in hospitals. We also know, staffing in nursing homes is tough as well. So some people, as staffing changes in nursing homes, that helps move people out of the hospital and step them down into that level of care. Although nursing homes aren't covered in this ARPA spending because they're not considered home and community based.
Thank you.
Representative Erf for a question.
Thank you, Mr. Chair. I just want to confirm something I think I heard. I may have heard it wrong. First of all, I was told this was a 10% FMAP as opposed to the sort of standard 6.5%. And then was something you actually had to apply for to get as opposed to the other FMAP stuff, which was sort of auto just coming on. Did I misunderstand those points?
You're referring to the enhanced 6.2%?
So, I'm sorry. Versus, yes, versus this one.
I wasn't involved in the initial application.
Director Lippman has some input.
We can put them at, move the tables down there so we don't have to play music chairs.
Yeah. Director, if you want to sit at one of those side chairs and use one of those mics. Director Lippman has something to add.
Thank you for the question, Representative Irf. You're correct. This was the 10%, and we did have to demonstrate that, as Melissa was saying, only certain services were qualified for the 10%. And so we had to put together a plan as well as of what we wanted to do. We also had to develop a methodology for claiming that had to be approved. It was a multi-step process versus the 6.2% that you're more familiar with was sort of automatic.
Thank you very much.
You're welcome.
Senator Bradley for a question.
Thank you very much. Good morning. So how does this funding intersect with what we did in the budget, in particular, the Senate Bill 36 provision for long-term care?
So I would say for this ARPA funding, it's a separate funding stream than what was approved for Senate Bill 36. But certainly they intersect with each other as both are focused on keeping folks in the community. So there are some places where it will overlap as far as, I think, especially the recruiting and retention dollars to help support that system of care for healthy aging.
And these, yeah, thank you, Mr. Chair, sorry. These funds would not be able to be used for rate increases for providers, is that correct? It's just for the four things outlined?
That is correct, yes.
Okay. Okay, thank you.
Director Lippman, anything to add?
No, I'm all set. Thank you.
Second.
Okay, motion to accept item 291 by Senator Rosenwald, second by Senator Bradley. Is there any further discussion on the item? Seeing none, you ready for the question? All in favor, say aye. Aye. Opposed, no. That item is adopted. Moving on to items 294 and 295, taken together. They're both about vaccines. And I guess Senator Edwards and Senator Irf both have questions on those. Who's ready first? Senator Edwards?
Representative Edwards.
Representative Edwards.
Yes, sir. Thank you, Mr. Chair. I have had an ongoing concern about the acceptance of money and the expenditure of money to have the state basically put in a position where it appears as though we are certifying or endorsing childhood vaccinations of the COVID vax. And I would like to know to what extent you think 294 and maybe 295 are going to end up spending money to try to market or make available the COVID shot to healthy children under the age of 18.
Sure. Good morning. My name's Ryan Tandian. I'm the Bureau Chief of the Bureau of Infectious Disease Control.
I don't know we've ever met. Are you new?
I've been in my role for effectively 11 months. I was there previously in an acting position. For a few
Okay,
months
well,
prior to
welcome.
that.
Thanks.
Excellent. Thank you. So both 294 and 295, yes, they do support both the Bridge Access Program, which is specific to adults and COVID-19 vaccine, and then our Vaccines for Children program. But this is more for internal operations to the program, not so much just the COVID-19 vaccine.
Follow up. Thank you, Mr. Chair. So this is internal operations. This isn't any sort of shots on wheels, getting it out to the public or schools. This is all just basically administrative management within the department?
Infrastructure, technology, and then operational costs. So the sources from the federal government on this actually prohibits us from doing direct purchase of vaccine, so we wouldn't be purchasing any vaccines with these funds.
Final follow-up. Okay, are you a physician or a clinician?
Yeah, I'm a registered pharmacist in the
Oh,
state of New
okay.
Hampshire.
So are you aware of any sort of definitive set of clinical studies that have determined the efficacy and safety of the COVID shot for otherwise healthy children under the age of 18?
I do have some other information that I'd be happy to share. I work closely with our state epidemiologist, Dr. Benjamin Chan, on this. As we know, with any vaccine, whether it's flu or pneumonia, there are ongoing studies to look at efficacy. So most related probably to the flu, we know each year that the efficacy.
So I'm specifically interested in COVID, and so it's kind of yes or no. You are aware or you are not aware of any good set of clinical studies to indicate the safety and efficacy of the COVID shot for children under the age of 18.
Representative Edwards, I believe we had provided, Dr. Chin had provided an item with a write-up of various studies on this topic. I can see if I can dig into it. It probably was last year. I think we had provided some kind of write-up where we included 100 different studies or something like that on this question.
So my question, I think, got it buried in the avalanche of studies. I just would like the very specific studies related to safety and efficacy under the age of 18, period.
Sure. Yep. So Dr. Chan had provided that science brief as Mr. White had
Have another
described.
person that wishes to comment and identify yourself first.
Hey, good morning. My name is Ian Watt. I'm the Deputy Director for Public Health. So as Nathan mentioned, we did provide a number of scientific studies provided both by academics as well as federal and state resources. Be more than happy to provide those again to the Fiscal Committee. I would focus the question that, ultimately our Vaccine for Children program in the state will only provide vaccines and support vaccines that are federally approved, that have been approved through various scientific boards as well as medical boards. And that has been our legacy policy. That continues to be our policy, to approve things that have been scientifically approved. And the COVID vaccine does qualify under those criteria.
All right. So I understand that there are boards that are positioned to be viewed as scientific boards, but I'm not convinced that they've been following the science in terms of making sure that these vaccines are safe and efficacious for this particular demographic. And I'm concerned that we're not doing a very good job of advertising the risks associated with it and the unknown part of the long-term effects of it. So please don't give me exactly what was given by Dr. Chen last time. I'm being very specific around studies that demonstrate the efficacy and safety under the age of 18. And so maybe there are new studies because it's been 9 months since I last asked, but so thank you. I just really think it's important that we protect our children, and I'm not sure that this program, the COVID vaccines, really do. So.
And critical to the conversation we have around vaccine in the department is the conversation between an individual, parents and children, and their PCP. So certainly we require that the people consult with their primary care physician who are evaluating individual circumstances and any concerns of parents they may have, and certainly rely on the medical community and providers to be well informed and have a dynamic conversation with their patients about what's needed and required.
Representative Erf for a question.
Thank you, Mr. Chair. Actually, my question is not related to these two fiscal notes, but it is related to vaccines, the COVID vaccine in particular. You've probably seen in the news, I hope I have, that nursing homes are having a difficult time getting the COVID-19 vaccine, and yet it is generally available in pharmacies for non-nursing home populations. And the federal government apparently has something to do with that. I'm just wondering, is there anything the state can do that can help with that problem?
Yep.
Have
So
another person that wants to have input?
yeah, so as we know, the COVID-19 vaccines have since been commercialized. So that has kind of changed or reverted back to the normal supply chain process for healthcare providers, including long-term care facilities, to acquire the vaccine. And, we have been seeing that in the news, and we're soliciting feedback from providers and long-term care facilities to see what any type of support that we may be able to help them with.
So you are looking into and trying to help them out. Is that the bottom line of what you just said? The nursing homes? Okay, thank you.
I move item 294 and 295.
Okay, Senator Gray moves the two items, and Senator Rosenwald seconds. Before we leave it, I have one more question. I want to be reassured on the record that these shots will not be forced on our children by putting them in the required list of shots before they can enter school.
That's correct. We've provided testimony for a number of pieces of legislation stating that we are not at all looking to add the COVID-19 vaccine to the school or childcare requirements.
Thank you. Further discussion on this item? Seeing none, ready for the question. All in favor, say aye.
Aye.
Opposed, no?
No.
Okay, you wish to be recorded? All right, two items are adopted with one negative vote. Now moving on to tab 9, the regular calendar. The item is 23-315 from the Department of Transportation. Are there questions on the item from committee members? A motion to move the item by Representative Leishman, second by Senator D'Alessandro. Is there any further discussion? Seeing none, all in favor say aye.
Aye.
Opposed, no? Thank you. Who moved it? Peter Leishman. Okay, moving on to item, I guess that was the last one, but we have some miscellaneous items that there may be questions on. I believe we have one on 23-280, Administrative Office of the Courts. Someone indicated there would be a question. No, I don't remember who. Was it Representative Edwards?
My only note to myself is I have a question about 312 on the informational materials. I don't have any until then.
Okay, these are just information. We don't need any motion to accept them. Senator Rosenwald?
I also had a question on the HHS dashboard, which
Okay.
is 306.
So I guess we're back to, thank you very much. I thought we had a
Thank you.
question on that one. I had a note there when we had earlier discussions. So we're back to Health and Human Services. And I see item 23-311. I had a note that Representative Erf had a question.
Oh, geez.
Before that's the dashboard. Which one?
306.
306. We'll go to 306 first. And Senator Rosenwald has a question on it.
Thank you.
306.
Just, my questions have to do with what is going on at Hampstead Hospital. There was just an article in the Nashua Telegraph this morning that the police, local and state, have been called 130 times in the last little bit over a year for issues ranging from physical assault to sexual assault, and that there are questions about the contractor. We had been told back in, when did we visit Hampstead as a committee? May, June, April, that the contract was about to be rebid, but now it looks like it hasn't been yet. I know the department has changed the management team, which is the only state employees, but they're not the ones who are providing clinical or other direct services to children. And I see that despite the promises of WellPath to increase the number of beds, we're still where we were when we bought the place. So I'm hoping that you have news for us on how we're going to make care at Hampstead more available and safer and better.
Sure.
Thank you.
So,
Probably not a question for Nathan.
I can provide some detail though on the contract and the RFP just to start. So we had gone out to bid for that contract, which expires in June. And we ended up canceling that, and I'm not disclosed as to say why. There's a state law that actually prohibits it. But we are going to be reposting that here in the next month. So expect to see a new RFP posted in November on that topic. Ann, do you want to take it over?
Hi, good morning. Ann Landry, Associate Commissioner. Thank you so much for your question and your concern. And I honestly wish I had more information for you today than was shared yesterday at the council meeting. And unfortunately, Commissioner Weaver and Associate Commissioner Henn, who are very involved with Hampstead and the leadership there, were unable to make today's meeting. But I can say that we have, as the department has been actively involved since the purchase of Hampstead, and with the leadership in place. We understand there has been some challenges over the summer. We've acted quickly. We have made leadership changes there, and that goal of that leadership is to work hand in hand with the leadership of the contractor and to be more collaborative and to ensure that we have our pulse on everything that's going on. We've been working actively with the local town municipal and law enforcement, as well as the state police, and our interventions have equated to a decrease in calls to the local Hampstead police, and so it is top of mind, and we are there every day working on it. And so I'd be happy to have Commissioner Weaver or Deputy Commissioner Henn now, as of yesterday, reach out and schedule some time with this group to talk more at depth.
Further
Thank
question?
you. I mean, reading that the police are physically restraining children so they can be medicated into submission, this is a hospital. And it is really concerning. I think probably not just to me, but it's certainly really concerning to me. I want Hampstead to be successful. And we have not been told that we haven't given the department the resources they need to make it successful. If there is something that the department needs to make it successful, I hope you will tell us, because this is really concerning. Thank you.
Thank you.
Senator D'Alessandro.
Thank you, Mr. Chairman. Just to follow up, first of all, we don't have enough troopers to cover the roads. So when you tell me that we need troopers to go to Hampstead, that's highly problematic. We got 70+ vacancies as far as state troopers are concerned. So we don't have the people. That's number one. And if the local community's law enforcement is being called upon, they have to get themselves out of other items to address these situations. We spent a lot of money to get the hospital. We spent 13 millions of American recovery money to buy the facility because the facility was going to take the place of what we were doing in the past at New Hampshire Hospital. All right, so we close those beds, we move them over here. We were supposed to be able to take care of the needs of these children. We visited the place and we saw what was going on at the place, and we saw the restrictions in terms of the usage of space. There was a lot of space that wasn't used because we couldn't get people. So just following up on what Senator Rosenwald said, if you can't get the people and you need more resources, there's a place to come. But we are being affected by the newspaper articles. People call us and say, what the heck is going on here? And the newspaper articles, sometimes they overblow it. I mean, what's the real truth? And that's the real issue. But the public's perception that we're not doing the job, and the fact that we have these huge lapses from HHS because we don't spend the money that we've allocated, that's very, very concerning to me. Very concerning to me. When you can lapse $100 million, that's a significant problem. When we all say, geez, we don't have enough money. Well, we don't have enough money. We're lapsing it. And that money, where's that money? Where the lapses going? They're going into the Revenue Stabilization Fund. So we're building that up, and at the same time, we're not answering the needs. This is something that really, really concerns me. I've dealt with kids all of my life, and I remember what we used to do here, and we've made dramatic changes. But this kind of stuff is very disconcerting. Thank you, Mr. Chairman.
Thank you. Comment?
I would just say thank you for your comments and concern. And I just want to assure you that we all have a shared interest and goal in here in keeping our children safe in the state. And we're doing everything that we can. And we can certainly have folks follow up on the specifics of whether we need additional resources or not at a later date. But we have a shared understanding and goal here.
Representative Edwards.
Thank you, Mr. Chair. Just for the good of the Fiscal Committee, Senator Birdsell has been leading Impacts Assessment Committee, taking a look at the impacts of the Sununu Center. And rather than just narrowing our focus on the new addition of the Sununu Center, she took it upon the committee to take a look at the entire effect of the existing legacy hospital and the challenges that have been there. And there's a subcommittee chaired by Mr. Edwards, Eddie Edwards, looking specifically at the security issues. And I know that he's in a final drafting stage of a report that may address many of your questions, Senator. And attendant with all of that is a public communications effort that the committee is trying to execute. I don't know the details because I've been in my house for 2 months, but I know that they're working it.
Thank you. Further comments from the committee on the item? Representative Leishman.
Thank you, Mr. Chairman. So a number of us have been sitting around the table and dealing with a Sununu nightmare. And this appears to be another nightmare in the making, and not to put either one of you on the spot, but you haven't really said what is going on, what's caused the problems that Senator Rosenwald mentioned in the article. Why haven't we been made aware of it? Why is the press hearing about it before we are? So what is going on over there?
Hi, thank you for your question. I can't speak to the timeline of communication around the events at Hampstead or how this group is traditionally informed on these events. I can just say that based on the events that have happened and some of the security challenges and risks, we've done everything we can to ensure that their security staff is fully staffed. I believe as of this week, correct? They are, and that there's been changes in leadership to ensure that the situations that have happened over the summer do not happen again, and that we're doing everything we can to keep the kids safe as well as get to capacity as soon as we can. So as Nathan mentioned, the RFP is being re-released to look at the contractor. And I know it's not a perfect answer. Again, Commissioner Weaver and Deputy Commissioner Henn likely have more information, more specifics to share with you, which I'm sure they'd be happy to follow up. Unfortunately, they weren't able to come today, but I don't want to misspeak as I don't have all of the answers to your questions today.
Follow up.
So again, this is offered in the spirit of helping the fiscal committee. In HHS oversight as well as the Sununu Impact Committee, this very issue has come up. What happened? We bought Hampstead. It had a stable state. It didn't have all these problems. Now it does. What changed? And the response that we got back, I think on the record somewhere, is that the patient acuity at Hampstead was not as high as the state changed it to being. And as a result, some kids got brought into Hampstead under sort of a new scheme of allowing a more difficult acuity. And that the Hampstead had not been designed to have secure features like doors in the hallways that shut. They didn't have the security staff. Basically, it was a little bit more of a surprise than I think it should have. And so there was this huge problem. And I would imagine if we were to look at the stats, I got to believe that the number of incidences and calls to the police has been declining precipitously is my theory. But so that's what I know about it. All right.
Anything further? All right, seeing none, we don't need a motion on this, but I also had questions on information items 23, 311, and 312 that are somewhat related. Again, HHS. I guess Representative Erf had questions on 2311.
So thank you for taking the questions. I have 5 questions. They're fairly broad, maybe even extremely broad. So I'm not expecting to be able to answer them now, but if you could at least take note of them and maybe provide written responses, I'd really appreciate it. So this is regarding the annual report on the Medicaid expansion program, if I'm not mistaken. And if I just, Mr. Chair, is it okay if I just rattle through the 5? We'll give them time to, in between, to respond if they want to.
Yes.
Okay. So the first, and I'll just pause between them. If you want to respond, that's great. If you don't, just say you don't. So describe, quote, the funding of the non-federal share to include, this is a quote from the fiscal note, the funding of the non-federal share to include profits from the Liquor Commission through the Alcohol Prevention and Treatment Fund, and here's the really critical part, and limited the New Hampshire Health Plan assessment to no more than the funding needed to cover the remainder amount, not to exceed the monies from insurance premium tax revenue and Alcohol Prevention and Treatment Fund, as well as other funds returnable. And I know that's related to HB4 from 2019. Do you want to respond now or later?
I think I can help, and if my answer is not enough, I'd be happy to, as you requested, put something in writing. So in terms of the Granted Advantage program, the federal match is 90% federal, 10% other funds. The other funds are comprised of three things primarily. The first one would be the premium tax, which is a standard tax applied to all health insurance policies of 2% on the policies that are ungranted advantage. The liquor profits, that there's a specific percentage there that's run about 10 million or so a year. In 2000, I think 18 or 19, the New Hampshire Health Plan is also assessed an amount, and the amount that's assessed is to make up the 10%. So whatever liquor and the premium tax don't equal up to, New Hampshire Health Plan makes a contribution of an assessment to fill out that 10%. The New Hampshire Health Plan in the prior legislation that was passed this last session didn't want that to be an open-ended item, and they said they would match up to 50%, meaning match exactly what both the liquor and the premium tax equaled. And so that's what's been making up the primarily the non-federal share. There are a couple other straggle items, like, for example, if we're able to recoup some money or on something that was paid out, that also helps fill that 10%. But that's majority of the funding is through those sources, and be happy to. It's a lot to follow. I'd be happy to map it out for you and for the committee.
So just to respond to that, you don't need to respond to this, but just so you understand why I still have questions, I'd like to know what the New Hampshire Health Plan assessment is, but I don't need to understand that right now. But the really critical part of what I was reading there was assessments to no more than the funding needed to cover the remainder amount, not to exceed the monies from insurance premium tax revenue. And that becomes, we don't, like I say, don't need to respond to that now, but that becomes relevant in some of my next questions in terms of what's what. So
Essentially, it's those sources fill up the non-federal share. I think the remainder amount, based on the current legislation that passed in HB2, adjusted how that calculation is done a little bit, but at the end of the day, the same concept applies, which is we have to come up with 10% of funding that's not general funds, and it's basically those sources, liquor, tax, and the health plan assessment. The health plan, sometimes assessment may have known as the New Hampshire Health Plan, sometimes was known as the high risk pool historically. They're very important in the 1332 waiver that the insurance department has in terms of helping us with the individual market. But that's their function today. They have the function of the supporting the 1332 waiver for the insurance department, and an assessment on all policies that apply that leads to the funding of Granted Advantage.
okay. It sounds like you started to address the significance of the remainder account, and I'll let that go for now. That was in my next question. Can you describe the provision? This is another quote. The provisions of the managed care contract to protect against overfunding the managed care organizations is addressed in the risk settlement mechanism?
Yes. They're in the environment that we've been recently operating in, where enrollment shot up because of the continuous coverage and the volatility in healthcare provider capacity, that predicting what would be the actual spend that we would see, we recommended not only by actuaries but by CMS was to put in provisions to protect from overfunding the program and limited the profit potential for the MCOs. And the way it's worked out has been that the state has gotten a refund back of the funding because they didn't experience utilization that cost a lot more than what we had actuarially provided for.
Thank you. That one made sense. Is there a document showing the annual total cost to the state, i.e. the non-federal dollars, and a detailed breakdown of where that funding is coming from in law over time? And you kind of touched on it in your earlier response. So maybe this one, if you just get it to me in a written
Yes,
form, I'd really appreciate it.
Sure. We're required each quarter to do a sufficient funding letter to leadership, the Senate President, the Speaker, and the Governor. We're also required every August to do a funding letter. It's actually in our conversation offline, it's one of the letters that I provided to you that provides the detail in terms of what is the expenditure and what are the other sources of funding.
So I appreciate that, and I have read the letter, and it does make sense. I guess I'm asking something in a little different format, if you will. So when we do our budgeting, like the state budget for Medicaid, for instance,
Right.
you can see the costs, you can see the breakdown of the revenues, federal, general, and so on. It's basically federal and general, maybe other in some cases. In this case, what you're describing shows costs in different ways. I just want to see, here's the cost for everything, all the little bits and pieces, and here's exactly where the revenues are coming from, pretty much as you described in the first part of your answer, but just in a nice clean way over time, so we can see how the cost of the program has changed over time, both in terms of going up, but also now that it's coming down.
Yes, and in the letter you'll see is that we're expecting it to come down $100 million from
Right.
the current last fiscal year.
Yep. And the last one is, and this relates to a spreadsheet you sent me that I reshared with you recently. So if it doesn't make sense, hopefully you can refer to that. Why would net non-federal funds, this is my term, not in the document, why would net non-federal funds show a surplus in a given year when HB4 2019 funds transferred exceed that surplus amount? I.e., why is too much money being transferred?
So it's kind of in the bigger picture standpoint, right? We make a forecast of what the program's going to cost. We ask for funding for it. The risk card is a good example of, if we don't get it perfect, right, is to make sure that the money comes back to support the program in future years. And the budget has had the Medicaid non-lapsing because there's been a lot of uncertainty in terms of what the volume and utilization has been, and that I think is what you're seeing in that chart, is that in some periods, for example, we may, from the non-federal share portion or even the federal share portion, expect to get spend more than we did. And so if we have a surplus of that, we just apply it to the next year to reduce the burden. I don't know if you want to add.
To clarify, Representative Erf, though, the spreadsheet that you're referring to is Granted Advantage Healthcare Program only. So RSA 126AA continually, there's a trust fund and it's continually appropriated to the department. So to Henry's point, we make our best estimates. If there are variations, there is a surplus, then that would carry forward and that would feed into the next year's estimates on what funding would be needed.
Okay, so I understand what you just said.
Yep.
But it seems like that the way you described it gives you a motivation to over budget because you're going to just keep carrying it forward and building up a huge surplus.
We don't for the Granted Advantage Healthcare Program, there is no motivation to over budget as passed in HB2 this past, and again, the funding has changed a little bit, but not significantly.
If I could just
Yep.
provide some context here. So like if these numbers I can validate more precisely, but just broadly, like we had a $1.3 billion budget for state fiscal year 23 to cover the entire Medicaid program. And I think like $33 million was the recoupment of the risk card. So as a percentage of total spend, it's really not a high amount, and a portion of that 33 million is due back to the feds for their share. So, we're talking about 1 or 2% kind of, variation from projected, and that's I think you would probably find to be pretty reasonable based on how healthcare costs kind of float around.
Maybe that other chart I asked about would help me here, because basically the 2019 HB4, as I understand it, is how you top up to solve the problem that you didn't have enough money going based on what the law was prior to that point in time. And so you're basically topping it up, which I get. But why would you top it up more than is needed to just maintain, as opposed to overshoot by $6 million, for instance? Now, I realize these are much smaller numbers in the Medicaid program for sure, but on a percentage basis, $6 million is substantial as an overrun, if you will.
So at the time, we're talking about a $500 million, well, almost a $600 million expenditure for Granite Advantage at the high point of enrollment. And going forward, that top off part that you talk about HB4, we're projecting in 24 and 25 not to need to tap into that provision. It's because Granite Advantage enrollment today is back to about 57,000 individuals. We were at 97,000 just on March 31st. So the whole situation, we're getting back to a more normal period. There's still some volatility because you're seeing some people who leave may be the lower acuity patients. And so I think we're getting to a more stable state, and HB4 was really there for, a contingency that actually happened.
Right. Just one last comment then. When you use percentages, comparing it to the whole $500 million program is not fair, because we pick up only 10%. So really what you want to be comparing it to is the 10%, which is something on the order right now around 56 million, and has been as low as 33 million a few years ago, and it's coming back down again now.
My percentage was based on not just it's both the federal and non-federal. You're right in terms of just looking at the state, if you will.
Right, and the overages I'm talking about are the state overages, not anything related to the federal.
Yep.
Thank you for your responses.
We'd be happy to follow up with something more concrete so you have something to take away for future reference.
Thanks very much.
Representative Edwards had questions on 312.
Do we want to move 311 or?
It's an information.
Oh,
item.
that's information. Thank you. Okay. Yes, I do. Thank you, Mr. Chair. First, I want to congratulate you for all of the hard work and great analysis on doing the Medicaid reimbursement rate adjustments. I only get called when people are unhappy about something in DHHS, but I got a call of concern in September about how the process was going, and then I got a call from the same person in October who said she's been working this issue on reimbursement rates in her segment of the industry for 37 years, and this is the best that she's ever seen her input considered and have the state respond to. So I think that's all really great, and I just want to thank you for all of that, because the committee's had ideas on what this thing would look like back in June, and earlier, but you guys really delivered. So I want to thank you.
Thank you.
For the question relative to Representative Verf, this is going to be easy because we sort of rehearsed it earlier. Under Medicaid, are people authorized to Medicaid eligibility if they are in the state in a non-adjudicated status, claiming that they are an asylum seeker? In other words, are asylum seekers who have not yet been adjudicated Medicaid eligible?
There is no eligibility status for someone who is not legally authorized to be here. I will say that all states are required, in an emergency situation, if someone shows up in an emergency situation, to cover that cost on a one-time basis, but there's no continued eligibility that exists.
Follow up?
Follow up.
Okay, so I'm being really clear here, because you use the term lawful. They're the
Lawfully residing.
yeah. So I'm not a lawyer. I'm not certainly not an immigration lawyer. So I'm just asking very specifically. Given that somebody who is seeking asylum is in the United States lawfully until they get adjudicated 3-5 years later, in that interim period, they're residing here lawfully, but does that mean they're eligible for Medicaid?
Typically, there's a 5-year waiting period for those that can gain Medicaid eligibility. This past session, the legislature adopted the lawfully residing for pregnant women and their children, which shortens the 5-year period. That will go into effect January 1. But other than that, this area of different levels of federal legally residing is a complex topic, which isn't an area of my expertise. But just in general, the individuals that are in the program are people who are legally residing and have gone through a qualification status and typically a waiting period.
Thank you, Mr. Chair.
Representative Erf for a question?
Thank you, Mr. Chair. I would like to reiterate Representative Edwards' words. You've done a great job putting this all together, and I really, really appreciate the time you've taken to help me understand all that you've done. It's really been very, very helpful. And I just have one question, and again, you don't need to answer it now, but I'm just curious as to how the rate increases that you've put in place here will impact the granted advantage costs to the state going forward.
In the informational item, the last 2 columns incorporate the federal and non-federal share that had to be taken into account so that the rates in the program are standard across the entire portfolio of programs in Medicaid managed care program.
So the total impact is $33 million. Is that accurate? 34 maybe?
Representative Erf, if you turn to page 3 of attachment 1, there are the totals for the other funds, the granted advantage other funds in column I, and in column J, there's the total federal granted advantage and federal funds right there. Yeah, so when you look at collectively with this appropriation, the $134 million of general funds that was made via HB2, it comes out to about $300 million and change total dollars that will be allocated towards increasing that. Some have already increased Medicaid rates.
Thank you very much.
Of course.
Senator Bradley for a question.
Yeah, I also want to follow up on what Representative Edwards said. And I think those of us in the Senate should give a shout out to our friends in the House for establishing the threshold of, as I recall, about $134 million in Medicaid rate increases. You guys did a lot of really good work. Listened to these folks. When it came over to us, we accepted that number of the $134 million, but enabled the department to be able to comply with all the waivers that they have to comply with, the parity issues that they have to comply with. And so this informational item is the result of that. And I think that, along with what Jess said, you guys deserve, the entire department deserves a big, huge shout out for pulling this together. Yeah, there were some people that would have liked a little more, but I think overall, you've risen to the task and shown, the benefit of what you folks established in your budget that we accepted in terms of the overall. So I think everybody deserves to take a bow, but I just want to, Mr. Chairman, give you and your committee a shout out, and then the work that you guys did. So you made it easy for us in the Senate.
Thank you, Senator Bradley. And you're right, it was a department effort. And one of the key people is sitting behind us, Christy Roy, who's director of the rate setting unit. And, without her, it would have not gone as well. She did a great job, and as well as other people in the department. So I appreciate that you recognize that too.
This is an unusual moment to hear all these compliments
I'm
given
soaking
to
it
the
in.
HHS. So put it on the newspapers.
Thank you.
Stick it on the wall.
Thank you.
Anything else on the information items? Before we go to the audits, I'd like to confirm a date for next month. November 17th would be the third Friday, which is our traditional meeting, and in the morning. Is there a problem with that? Senator
Mr.
Bradley?
Chair, I'm going to be out of state that weekend. I would actually, if we could do it on Tuesday, the 14th, whatever time of the day you find appropriate.
We'll
would
have
be-
a lengthy meeting in the Finance Committee on 50 bills from morning till late on the 14th.
Well, the reason I ask is that I've been asked by the Attorney General to file a LSR dealing with a YDC, so I would like to be able to participate in that fiscal meeting. So if it's not possible, it's not possible, but
Wednesday or Thursday, not?
I am leaving actually on Wednesday,
Okay.
so.
Anybody else with a problem on the 17th? Any other day that, it's not a busy week other than that 14th, that we've got the full Finance Committee meeting, and the 17th is a deadline, so there might be people trying to squeeze other things in. But as near as I know, if we went to the second Friday, would that be a problem for the LBA or the departments? Thursday's a holiday. 10th is a holiday.
10th is a holiday.
How
Okay.
about the 9th?
The 9th? The 9th is not a holiday? Anybody have a problem with the 9th?
As long as it's in the morning.
Morning of Thursday, the 9th? Excuse me. Works for you, Senator?
Yes, yes, thank you very much. I
All right,
appreciate
so
that. Now you know why I gave you so many good shout outs.
one hand washes the other.
But you deserved them, so there you go.
There were some other ones we were not quite agreement on, but we'll come to that later. Is there a problem if we do it on the 9th for the LBA? 10 o'clock? Fiscal. Thursday, 9 November. Canceling 17th.
What's that?
Okay,
Yeah. Yeah, yeah. she-
now we're ready for a very good audit.
Yeah, yes. This is a very.
Good morning.
Good morning, Mr. Chairman. And members of the committee. For the record, I'm Christine Young, Director of Audits for the LBA. We're here to present the Performance Audit Report for Mental Health Workforce Licensing. Vile Skids, Senior Manager with our office, was the charge manager on this audit. She will present the report.
Thank
And
you.
also joining us in the back is a designee from each of the boards who oversee the licensing and certification of mental health professionals in the state, as well as the executive director of OPLC, who may wish to address the committee and are available for questions. And with that, I will turn it over to Vile for the presentation.
Good morning. Morning, Mr. Chair, members of the committee. My name is Vile Skids. This morning I'll be presenting the mental health licensing performance audit. The purpose of our audit was to determine whether there were significant barriers to entry into the mental health professions imposed by licensing boards during fiscal year 2022. Our audit reviewed initial licensing requirements for 15 mental health professions overseen by the boards of mental health practice, psychologists, licensing for alcohol and other drug use professionals, medicine, and nursing. We also reviewed OPLC processes to determine their impact on initial licensing. Our executive summary starts on page 1. For most mental health professions, we found New Hampshire's education, pre-license practice, supervision, and exam requirements generally aligned with those established by national professional organizations. And for most professions, we found New Hampshire's requirements were in the middle or slightly lower when compared to other states we reviewed. While we found statutes and rules did not impose substantial licensing barriers, some board procedures may have unnecessarily prolonged the application process and impeded streamlining. For example, some boards required case-by-case review of every application at a monthly board meeting, regardless of the licensing risk posed, which prolonged the time it took to get a license. And reviewing all criminal convictions, regardless of how long ago they occurred or whether they were substantially or directly related to the profession, also hindered faster processing. Additionally, mechanisms implemented by some boards to expedite licensing for individuals who are already licensed in another state did not appear to save time or reduce documentation requirements. Laws passed at the end of the 2023 legislative session transferred some of these responsibilities to the OPLC and could facilitate a more streamlined approach. However, rules still need to be developed for this process. As shown in our recommendation summary that starts on page 3, our report contains 12 observations and recommendations. All 5 boards and the OPLC concurred with all 12 observations, and 6 observations may require some legislative action. Our first 4 observations address license portability. Portability is generally defined as the ability for individuals who are already determined qualified to practice in one state to transfer their qualifications to another state. Nationally, states have been reviewing their process to facilitate portability and address workforce issues. During the audit period, New Hampshire laws required boards to facilitate license portability by identifying the states that have equal or substantially equivalent licensing requirements. It also required boards to publish a list of states with which New Hampshire had reciprocity agreements or had entered into multi-state compacts. None of the boards had a process to identify the states which may have equal or substantially equivalent requirements, and no boards entered into reciprocity agreements. During our audit, we reviewed basic licensing requirements for 15 states and compared them to New Hampshire. That information is found in Appendix D. Laws that became effective at the end of August 2023 placed the responsibility of determining what is considered substantially equivalent under the purview of the OPLC director. State laws also required boards to identify the states for which they have established criteria for licensure by endorsement. Endorsement is an expedited process where states consider the qualifications of an applicant who already holds a license in another state to determine whether these qualifications can be considered substantially equivalent to their own. Board processes intended to expedite licensing for individuals already licensed in another state did not significantly reduce the amount of time for them to obtain a license. For some professions, applicants were still required to provide most of the same documents as someone who's never been licensed before, and most boards still required applicants be reviewed on a case-by-case basis. Board laws allowing individuals already licensed in another state to practice temporarily while their application was pending in New Hampshire was also not aligned with more recent overarching state law and appeared to be underutilized. Overarching state laws establish specific criteria for obtaining a temporary license. However, some boards imposed additional requirements. Additionally, while overarching state laws allowed temporary licenses to be valid for up to 120 days, timeframes in board laws and rules allowed them to be valid for between 30 and 180 days. Finally, state laws required boards to develop processes to facilitate portability for members of the military or military spouses. However, no boards have developed these processes. Our next 2 observations, numbers 5 and 6, address timeliness of application processing. We found time limits in some boards' rules did not align with overarching state laws for certain aspects of the application process. Additionally, while we found boards met processing timelines established in statute most of the time, they could not actually determine whether they were meeting timelines because the licensing system did not collect dates associated with key events that would have been necessary to monitor timeliness, nor was there a process to manually collect these dates to ensure compliance. Observations 7 and 8 address developing or expanding a tiered approach to approving license applications. A tiered approach, including approvals at levels below the full board, could have reduced approval time for some applications presenting low risk, allowing these applicants to practice sooner. 2 boards required all applications to be reviewed by at a monthly board meeting, even ones that pose lower risk. 1 board allowed OPLC staff to approve some applications and issue licenses. However, other types of lower risk applications could have potentially been approved without full board review, reducing the time for some applicants to be licensed. In July 2023, the OPLC became responsible for approving or denying license applications, facilitating this tiered approach. However, OPLC is still developing rules for this process. Observation number 9 addresses board practices for reviewing applicants' criminal histories. State laws allowed boards to disqualify applicants for criminal convictions that had a substantial or direct relationship to the profession, and if disqualified, the applicant protected public safety. However, boards did not identify which convictions were substantially or directly related to their profession, and 3 boards required applicants disclose criminal charges, even if they did not result in a conviction. Laws also allowed boards to consider the time passed since the conviction, but none of the board's laws or rules considered this, and applicants were required to disclose all convictions regardless of how long ago the conviction occurred. Observations 10, 11, and 12 address the need to develop rules for some licensing processes used by the boards, ensuring these requirements are clear and consistently applied, and reviewing whether exam requirements may be too restrictive that they delay licensing or hinder portability for applicants who are already licensed in another state. This concludes my presentation. I'd like to take the opportunity to thank the OPLC and especially the boards for their cooperation during the audit. Responding to all 12 observations in addition to dealing with their normal course of business was not an easy feat. But the boards were cooperative, worked hard to respond to the observations, and met our reporting timelines. We wanted to make sure the committee was aware of their hard work. I'd like to invite Lindsay Courtney up. She's the OPLC Executive Director. She has a few comments.
We're going to have a couple questions here, but you can take one of those side seats and be ready to possibly answer it. First, Senator Pearl and then Representative Edwards have questions. Senator Pearl is recognized.
Thank you, Mr. Chair. I'm quickly reading through this as you're providing the information. The summary that you're reading, is that essentially in here, all of that information?
It is. So if you look at our executive summary, most of the stuff that I said in the very beginning, it comes directly from our executive summary. So all of that information is on pages 1 and 2. And then the observations go into more detail.
I found the remarks as you presented them very easy to follow. Was it possible that you have a written version of that you could get to me?
Of my remarks?
Yes.
I do. However, I'm going to defer to my director as to whether or not I can release that.
If I could, Senator Pearl, we'll have a transcript, a verbatim transcript for this meeting, so I can make sure to get that to the members.
That would be excellent. Thank you.
Representative Edwards.
Thank you, Mr. Chair. This feels like really very good work, so thank you for that. You've got approximately 6 recommendations here that you think may need some legislative action. I'd like to ask you 2 questions about those. One, is there 1 or 2 of them that would have the biggest impact on improving our service capacity in the state? And if so, what are they? I'm looking for a prioritization of these 6. And then sort of attendant with that is to make sure that we don't drop the baton. Who is working with who in the legislature to take legislative action?
So I will address the first part of that, and I will defer the second part to Lindsay Courtney to answer. So as far as the observations that require legislative action, there's 6 of them. A lot of them are clarifying some language or getting rid of negated language that was superseded by more recent laws. So as far as impact, I think number 12 may have the most impact, which is looking at the exam requirements for marriage and family therapists and clinical mental health counselors. The laws are very prescriptive as far as what national exam a person must pass. There are other exams out there that would prevent someone who passed a different exam from being licensed in New Hampshire from getting a license. So as far as impact, that one probably has the most impact. And most of the others are removing some negated language, looking to see, clarifying some laws to, let me back up a little bit. OPLC was given some authority to oversee certain processes. Some of that language is still in the board's practice act, so making that a little more clear that the responsibility has been transferred to OPLC and not creating that confusion between the two languages that don't exactly match. I think that would help clarify some certain things, but most of these recommendations are in that nature.
So thank you for drawing our attention to observation number 12. That's useful. All your comments are useful. And then, so for item 12 specifically, who in OPLC or wherever is working with which legislator to implement 12?
I think I can answer that question partly. This division works for the Fiscal Committee. When they bring an audit to us, we're the first people that see it. No one else has seen it until we clear it and publish it. I always take the action that we are responsible for anything that comes to us needing legislative change. I usually file it myself. I'm going to have to go to Rules Committee to ensure that we can get this in a timely way, since both the Senate and the House have passed their deadlines for final legislation. I will go to Rules and I will ask for permission to file the bill, and then I will ask for the 6 different ones who might be the liaisons. Obviously, they're different boards and so on, and so I can take this. I admire the work. You always do excellent work.
Thank you.
This was very timely, as we're hearing from HHS, the problem in staffing all these positions. And you did some wonderful work where when I take it to OLS, you even mentioned the law that needs to be changed.
Yes.
They're going to appreciate that. It's going to make it much quicker. Also, the work you've done for the boards in Appendix D, which you found they'd never done this before, should hopefully expedite when someone comes from another state. All they've got to do is look at Appendix D, and if it's all green and yellow, boom. Don't waste a lot of time.
Yeah,
So
we did only
hopefully-
look at 15 states, so there are other states, and we've talked to the boards about how to prioritize looking at other states as well.
It's an excellent start. Senator Rosenwald.
Thank you, Mr. Chairman. I just wanted to say that I have filed a bill that's not unrelated, which could be a vehicle for these statutorily.
Are you willing to
recommendations.
put all these on it?
Yes, I have already texted Director Courtney asking if we could chat after this meeting.
So I guess what would be required if we saw a liaison for each of the 6 ones, because there's quite often involved different boards.
Mm-hmm.
So and I would like to be a co-sponsor with you.
Oh, yes.
Because I take very seriously when this audit division comes before us and said, you need law changes, you're talking to me. That's my
I want to put
responsibility.
you on my spreadsheet.
And so,
Thank you.
I don't want them to spend a year's work and then have everybody just say, and not do a thing. This is an important method for us to correct our legislation. Senator.
Thank you, Mr. Chairman. Mr. Chairman, both NCSL and CSG have spent a lot of effort working on reciprocity and working on boards. it seems to me that that work has already been promulgated. It could really be used quite effectively in terms of what legislative changes we need and how more of a synergistic relationship could be established. Because one of the problems that we face is the dilemma of non-reciprocity for a person coming from our state, from another state, and that's a barrier that we've got to overcome, because we need a fluid situation here, and the national organizations have worked hard to try to get that done. Just a comment. Thank you.
And Senator D'Alessandro, the first 4 observations in our report actually address portability and trying to create a better process for people coming from other states. So.
Senator Erf for a motion.
Move to accept, place on file, and release. Sorry. Move to accept, place on file, and release to the public in the usual manner.
Second by Senator Gray. Further discussion? Opposed, you said?
We have,
No,
Mr. Chair?
yes,
She's been trying to get our attention, lady at the end of
the director of OPLC. Let me make this, accept this motion,
Of
then I'll
course.
recognize you. All in favor, say aye.
Aye.
Opposed, no.
Thank you, Mr. Chair, members of the committee, Representative Edwards. So I know you're trying to get out of here, and I appreciate the hard work. I just wanted to say that thank you to the LBA for the collaborative environment in which we worked on these issues, and to the boards. But really, as you'll see, there are 2 issues that were really identified as it relates to OPLC. One is the current conflicts in the law. I'm happy to report that we have been working with Representative McGuire and Representative Groda out of EDNA, and she is has plans to file legislation that would eliminate a lot of these conflicts. So I think that's already in the works. We drafted the language, it's about 120 pages, so when you see it, I apologize in advance. The second issue really concerns portability, and this audit was particularly challenging because of all of the changes during the last legislative session. And I just want to thank members of the General Court for all of the hard work that you did, because I think HB 594 in particular was really critical to moving the ball forward as it relates to portability. So that was the legislation that essentially gave the office the authority to determine what states are substantially similar, or what the criteria is substantially similar. That work is already being done. The interim rules that the office filed related to 15 professions, I believe, but included all of the mental health professions, and were effective on Sunday. And through these new rules, we were able to already get through hundreds of applications, not necessarily in the mental health professions, but particularly for physicians. So I think a lot of this work is underway, and what we're looking at is really just a cleanup effort as it relates to the statutory authority. I just wanted to mention 2 things for consideration as it relates to the exam and number 12. I think that requires a little bit more inquiry, because I think there could be some consequences as it relates to portability were the state to accept other examinations. The state is currently a participating state in the Mental Health Compact. I am the New Hampshire representative on that Compact Commission. And part of the requirements to participate in the Compact is that you require a national exam. So I'm not saying that the other exams wouldn't necessarily qualify, because the commission is currently promulgating rules as it relates to the exam, but there could be unintended consequences. And so we may want to look into that a little bit deeper before pursuing additional legislation. And as of right now, I believe over 40 states have signed on to the Mental Health Compact.
Thank you
So
for your
thank you for
input.
your time.
And we just keep piling stuff on you for licensing. And
It's awesome. It's great. We're doing great work. So thank you to the board and to the staff. No, it's been wonderful.
Well, you have streamlined things immensely, and we appreciate it, but it kind of loads it up in your office. So keep up the good work.
Thank you, Mr. Chair.
All right. Senator Pearl.
Thank you. So Director, you brought up compacts, and it was actually going to be a question I was going to ask you. As we move forward and we start to adopt these compacts, do you think that is going to ease up some of the need for reciprocity and licensing, because some of the folks that are coming here may be licensed in other states and they can do so under the compact rather than needing to come under the reciprocity clause, I
Yes.
guess?
So yes, Senator. So there essentially are two compact models. There's the multi-state compact model, which is what nursing has, which basically means if you get a license in your home state, you can go anywhere. That's part of the compact. That is the best in terms of portability. There is risk there because you don't know who's in your state. And so when we talk about mental health professions in particular, where they're not necessarily always working in an environment where there's supervision, certain professions have chosen a different model, which is a privilege to practice, which is that you still have to come to each state and get a privilege based on streamlined requirements. The benefit to a compact is always that you can share data. There's a requirement that you share data. So as it relates to investigations and discipline, we know more about that person if we're part of the compact than we don't. But I view it as really concurrent models that you could use. There are some states that are never going to participate in a compact for various reasons. And that doesn't mean, though, that they don't have similar requirements. And so really, I think the state should be looking at all options for portability. You mentioned, Senator D'Alessandro, that CSG and DoD have been working on this. I've had the privilege of working in drafting the social work compact language with CSG, and it's really intended to help support our military families and to make it easier. So I think there's a lot of work that we can piggyback on and implement in New Hampshire.
Thank you. Anything further from the committee members? And I'm sure that Senator Rosenwald would appreciate any of the rest of us being co-sponsors on the bill, since she's taking the lead on doing all this. And thank you for all the good work you've done. It should make it easier for OLS, and hopefully we'll talk to Representative McGuire as well, and maybe get her in on it so we can see that we don't have any conflicts and stuff she's filed. Is there anything else to come before us? Okay. I would entertain a motion to adjourn. All in favor? We are adjourned until, we said, November 10th? 9th, November 9th. November 9th at 10 a.m. Thank you. Senator Gray. All right, thank you very much.
You don't know what the underlying bill that she was gonna put in and said, so.
There's one?
You don't know what underlying bill.
You're right, but as long as she includes this stuff, I'll have to look it over and then decide.
Yes, sir. Yes, sir.
Yep. All right. All right. Thank you. I was impressed. Usually the cinema was